Hi there, I'm Dr. Giyaur, and today I'd like to talk to you specifically about a problem that I treat a lot, and it's tear troughs. I'm an ophthalmologist by training, so a lot of people come to me specifically for upper and lower eyelid problems. So tear trough is a common problem, and it's not necessarily age-related. It's actually genetics, right? So it's the structure of the face, it's the structure of the orbit or the bones around the eyes that makes some people develop the tear trough, the prominent tear trough, a little bit earlier. And people complain of different things. People tell me, oh, I look so tired, everybody asks me if I rested well. Oh, I hate the puffiness under my eyes. Oh, I hate the gone feeling under my eyes. I look like I haven't slept for days. And it could be really young people, and there are people in their 20s that come complaining of it. And definitely as people age, definitely it becomes a problem. And sometimes even the fat that sits around the eye prolapses forward and makes the tear trough very, very apparent. And in some people, it actually starts looking a little bit dark. And it may not necessarily be because their skin is looking dark, but it's just because this area lost a little bit of volume, and then the shade falls on it and makes it look dark. Or sometimes it's the prominent blood vessels that become very prominent as we lose the volume in that under eye area. So it's a fairly easy problem to treat in most people, not in all, but in most people. And specifically, I wanted to talk to you today about the under eye filler, the tear trough filler. It's a great procedure. It's really a lunchtime procedure. It takes about 10-15 minutes to accomplish. I always do it with a cannula just because there's a lot of blood vessels and I don't want to bruise anybody. Typically, there's no bruising involved at all. It's a very comfortable procedure because all of these fillers, they have lidocaine in them, so it's a very comfortable procedure to undergo. Typically, or not typically, but always, I would use restylane-l specifically filler for the tear trough, just because it gives me the best results, the most natural. You can't see it under the skin in the eye, and it really doesn't give me that swelling that a lot of people complain of after getting the under eye filler. So I think I've mastered that technique for under eye filler. So if you want to learn more about it, if you want to get a consultation, please give us a call.